Hello lovelies, I bring you greetings and I welcome you all to my YouTube channel, Mabi Health, as your favorite nurse, Mabel. And on this channel, we talk about everything health. And so today we want to talk about hypertension, high blood pressure. Let me know about your thoughts on high blood pressure or hypertension in the comment section below. So let's zoom into today's topic, hypertension or high blood pressure. So hypertension or high blood pressure is basically increased pressure in your blood vessels. And this is a very common condition among our old folks, and it's even very common among young ones now. Yes. So hypertension, as I said earlier, is very common, but can be very life-threatening and very serious if not treated. So let's all note that with hypertension, a lot of people, like 90% of the people with hypertension, do not show symptoms until their blood pressure gets to a very high level, and then they begin to see certain signs. So hypertension can stay with you for a very long time, and within these times, because you are not having any symptoms for you to know, it's very detrimental and it causes damage to your blood vessels and even your overall health. So what hypertension does is that when it increases your blood vessels and your heart, the workload of these two increases as well. And so with time, the walls of your arteries becomes damaged. And there's this thing we call LDL and HDL, low density lipoprotein and high density lipoprotein. The low density lipoprotein is bad cholesterol, yes, and then the high density lipoprotein is good cholesterol. And so when the walls of your arteries becomes damaged, LDL deposits plaques along the walls of your arteries, and the lumen becomes smaller. So we call this atherosclerosis, where plaques are being deposited along the walls of your blood vessels, which makes the lumen of the blood vessel very tiny. So let me use the stethoscope as an example. So let's take the stethoscope to be your blood vessel. See how thick it is. Yes, so obviously the lumen is big. That is the whole inside is big. And so when the heart is pumping the blood and is moving to the various body parts, it moves smoothly because the lumen is big and there's no clots, there's no blockage blocking the blood from flowing. But then when atherosclerosis occurs, which is the deposition of plaques along the walls of your artery, the lumen becomes narrow. So let's say that it used to be like this. The lumen of your arteries used to be like this. When atherosclerosis sets in, it can be this small. So you can just imagine the amount of pressure needed to pump blood when the lumen narrows from this big to this small. Yeah. So when atherosclerosis sets in, it predisposes you to a lot of conditions, which in turn brings about hypertension. Okay, so let's talk about causes of hypertension. Causes of hypertension depends on the type of hypertension you experience. We have two basic types of hypertension, which is the primary or essential hypertension and then the secondary hypertension. With the primary hypertension, it comes within a period of time. It's gradual. Okay, you don't just get up one day. This applies to somebody who has been monitoring his or her BP. So you don't just get up one day and then your BP shoots up. No, it develops over time and it is gradual. But with the secondary hypertension, it's a sudden onset. It just comes because of an existing or underlying condition. So primary hypertension is gradual, and the cause is not really known, but with the secondary hypertension, it's an early onset, and it's as a result of an underlying condition. Yeah. So let's talk about some of the conditions that brings about hypertension, secondary hypertension. Yeah. So we have kidney problems. So you have problems with your kidneys. It can result in hypertension, secondary hypertension. We talk about adrenal gland tumors. We talk about thyroid tumors, congenital blood defects. With congenital blood defects, as I demonstrated atherosclerosis to you using the stethoscope, because there's a defect in the blood vessels, the lumen is already either blocked, choked, or narrowed. Yes. We talk about certain medications like birth control pills, cold remedies, and some over-the-counter drugs. That being said, I would plead with you that anytime you feel any symptoms, please don't walk into a chemical shop. Don't walk into a pharmacy to get a self-prescribed medication. Please make it a point to go to the hospital or a clinic. You can only go to the pharmacy or a chemical shop to buy any medication only when it has been prescribed to you by a prescriber, a qualified prescriber. Because most of these over-the-counter medications predisposes you to a lot of conditions, not only hypertension, a lot of conditions that when we talk about them, you'll be marveled. So please, your health first. Do not walk into any chemical shop or any pharmacy to buy a self-prescribed medication. Go to the hospital first, and the nurses and other health workers will take care of you. Thank you. So let's talk about diagnosing hypertension. Yeah, so with hypertension, you don't just say that you're hypertensive or you have high blood pressure because you once checked your blood pressure and it's high. Before you will be diagnosed of hypertension or high blood pressure, your BPs would have been checked at least like 5 consecutive times, and then you can conclude that throughout all those 5 times you checked, your BPs were high. Then we'll diagnose you of hypertension and put you on medication. Yeah. So with hypertension, it comes in 2 readings. You have the upper value and the lower value. We call the upper value systolic value, and then the lower one diastolic value. So we measure it in millimeters per mercury. So that should tell you that it is 2 in millimeters and in mercury as well. So with systolic blood pressure, that is the top. It's basically the pressure, how the blood pressure that is being recorded when your heart is beating. You know, your heart beats boom, boom, boom. So as the heart is beating, the blood pressure that is being recorded is the boom, 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 boom. You get it? And then the diastolic, which is the down one, is between the beats. So boom, between the beats, boom, between the first boom and second boom. I don't know if you are getting me. Between the boom, 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 between it is the diastolic. Yes, and then the ones that is being recorded when the boom, boom, boom is going on is the systolic. Yes. So let's talk about the categories of hypertension. We have 5 categories. We have normal BP, as a normal blood pressure. We have elevated blood pressure. We have stage 1 hypertension, stage 2 hypertension, and hypertension crisis. So with the normal blood pressure, it's 120/80. That's the standard, 120/80. But you realize that some people's blood pressure is a little bit below the standard. and others is a little bit above the standard. So you have somebody recording lower than 120/80. It does not mean that the person's BP is abnormal. It is very normal, but then theirs is a little bit above the standard. The standard is an average, yes, and so you have somebody below or above it. Okay, and that being said, pregnant women, ideally their BPs should be lower, either the standard or way lower than the standard. Yeah, and if your BP is, let's say, 50/40 or 60/50, it is too low. We call that one low blood pressure, and that one too is managed. When you get to the hospital, we check your BP and we realize that it is low, way lower than the standard. We put you on fluids so that we can get the BPs coming back between the normal range. Yeah, so the second one, which is the elevated BP, you have the systolic being 120 to 129, and then the diastolic being below 80 millimeters per mercury. Yeah, we talk about the hypertension stage 1, where the systolic, the upper one, is between 130 to 139, and then the diastolic is between 80 to 89. Yes. The fourth stage is stage 2 hypertension, where the systolic is above 140 and above. The top one is 140 and above, and then the down one too is 90 and above. So stage 2 hypertension can be a blood pressure recording of, let's say, 150/90, is stage 2 hypertension. And then when we talk of hypertensive crisis, which is the last one, it is higher, 180, 100, 180, 150. Some people go up to 200, 230, even 240, 150. Those ones are hypertensive crisis. And when you reach that stage, you need to come to the hospital immediately. The dicey part of it is that you wouldn't know until you check. There's no way you will know your blood pressure is high until you check. And sometimes some people have certain symptoms that they feel, which tells them that, Charlie, your blood pressure is high, you need immediate help. When you get into hypertensive crisis, normally the other 4 categories that we spoke about, it does not give you any sign or any symptom, and so you wouldn't know that your blood pressure is going up unless you check, or until you check it, you would not know. But as soon as you get into the hypertensive crisis, you realize that there are some peculiar signs and symptoms that you feel that should inform you that your BPs are in the dangerous states, and so you need an immediate medical attention. So we talk of blurred vision or double vision. We talk of lightheadedness or fainting. There's fatigue, there's severe headache. There's also palpitations, that's your heart begins to beat very fast, and you even feel the beating yourself. You don't need to touch your heart before you feel the beating. Just as I'm sitting, you sit and then you realize that peri. Yes, that is what we call palpitations. You realize that you get epistaxis. Epistaxis is bleeding in the nose, and so you'll be sitting down and realize that blood is oozing out of your nose, and it's not just a drop of blood or about 2 or 5 mils of blood. Like, it comes, I say a beer pipe, no, it means that your blood pressure is very high and you need an immediate medical attention. There's also shortness of breath, there's nausea and vomiting. Then you begin to vomit, and right after the vomit, you realize that palpitations follows too. You have chest pains, nausea, and in most cases, there's confusion. confusion as in the person becomes mentally retarded, sort of. I say, okasa insiso. Why Jimmy? The person does not even recognize the people la one omo honey biom. I say bibi obey biano, sebi o. I say bibi ahoma biati woni dream. Aha. Those things. It all tells you that your BP is very high. And so you need medical attention. Please, when these things happen, don't sit down. Especially with the severe headaches, epistaxis, palpitations. Like your body is warning you, mommy, sorry, call hospital. Papa, sorry, call hospital. UBP. If you don't listen to these instincts that your body is giving you, and you don't follow up and come to the hospital, before you realize CVA has set in, stroke has set in, you may even die before you get to the hospital. Hypertension is very serious. It's not something to joke about. Of course, a lot of people are working with hypertension. It doesn't make it any less serious because BP, I mean, it's only hypertension. No, please don't do that to yourself. Hypertension is deadly. It comes and then later invite other conditions to come and join him. I say one high diamond be na nipa na betre no nkwa na ba yo afei dey 2 weeks 3 weeks after some months obekọ dem ho na nkofo be 1000 dey go. That is hypertension for you. We call it the silent killer because in most cases it does not give you any symptoms, but as time goes on you realize that wankasa ohunamone enye wo fine, or the next thing we hear nipa ne. And you hear people say these things I hear is a lot. Oh, wewu. Na she no. And dry numerical na me na na edi banku. And say no ko die one sorry. Oh, if you we cry na me ne wa. Me ne cry na call ba ho na. And then na di wood ye. The hypertension was there, but because you didn't give attention to it, education has been going on. Just go to the hospital, walk into a drugstore, a chemical shop, or a pharmacy, and your BPs will be checked for you. Please, BP is no joke. Don't joke with your life. We only have one life, and so be very careful. All right. So on this note, we'd like to end here on our hypertension series, and we'll continue in our next video. Thank you so much for staying with me. And please like my videos. Please subscribe to this channel if you've not. Support your girl. Please support me. Like my videos and share. And to my old subscribers, thank you so much and God bless you. See you next time. It's bye.